We have clinical profile and outcomes of Filipino adults with paroxysmal nocturnal hemoglobinuria at a tertiary hospital, a cross-sectional study from 2015 to 2020. We have Dr. Corilyn Joy Pajares from the Philippine General Hospital.
Good day. PNH is a clinically heterogeneous rare hematologic disease. This study describes the presentation and outcomes of PNH patients and management in a low-resource setting. This is a retrospective descriptive chart review of 45 patients. Majority had classical PNH and there were more males than females. The most common presenting symptoms were fatigue, exertional dyspnea, pallor, and hemoglobinuria. Most common complication was hemochromatosis, and 3 had thrombosis. 3 patients expired due to infection and bleeding, and at 12 months from diagnosis, all patients were alive. Survival probability at 24 and 48 months was 94.09%. All patients received supportive management with blood transfusion and or steroids. This study has been able to provide us important insights in the course of the disease. Delay in the identification of patients increases risk for complications. Thank you.
Thank you, Dr. Pajares. Let's proceed to the Q&A portion. For our first judge to ask is Dr. Isberto.
Good morning, Rachel. Rachel, sorry. Good morning, Corilyn.
Good morning, ma'am.
So, medyo naguluhan lang kasi ako just to enlighten me,
Yes,
me. So, I have a clarificatory question. So, basing on the bone marrow features, okay, so if you're gonna base it in the bone marrow features, would there be a would there be a difference in the outcome? Okay, so between your classic example, your classic PNH versus your patient with aplastic anemia?
Thank you, ma'am. Actually, what happens in the bone marrow biopsy results, but there is a difference between your classical PNH and your aplastic PNH and your MDS PNH because the patients with overlapping syndromes also manifest with the results in the bone marrow biopsy that are correlated with their other disease entities like aplastic anemia and MDS. Now, with aplastic anemia and MDS, we actually have a higher risk for more transfusions and infections, and then these are considered complications also of the disease, and this will affect the survival of the patient.
Thank you, Dr. Isberto. Next, we have Dr. Uy.
Okay, thank you. Thank you, Dr. Pajares. So, what's the most common complication observed in your study?
Among the patients we studied, ma'am, hemochromatosis actually was the number one among the complications po. And then for those patients who were expired or who passed away, these patients died because of bleeding and infection.
Okay, so what's your longest survivor? How long?
For this study po, we were able to follow up the patients starting 12 months, and then the highest was 48 months. So the survival probability actually, I presented also that I divided it into those with prednisone and no prednisone, 96.15% with prednisone, overall 94% for 48 months, ma'am.
Okay, so what was the outcome of that patient who had a complication of thrombosis?
Among the patients with thrombosis, these patients were the one actually who survived, ma'am. Those who expired were those with bleeding and infection. So it was different from those from the international data in which more patients died because of thrombosis.
Thank you.
Thank you, ma'am.
Thank you, Dr. Uy. Next, we have Dr. Vicente.
In your study, were you able to determine yung presenting symptoms nila and how they presented, and how they were able to see you, how they were referred to you?
Yes, sir. Actually, differing also from the other studies, wherein in international studies, usually they will present with hemoglobinuria. A lot of our patients presented with constitutional symptoms like fatigue, exertional dyspnea, pallor, which is actually a very important factor because there might be a delay in identification of the patients because of the non-specific symptoms that they present with.
Thank you.
Thank you, Dr. Pajares.